You know what terrifies me? That nearly 75% of people over 65 have high blood pressure, but most are managing it completely wrong. I'm talking about mistakes that could be the difference between living independently at 85 or not making it there at all. Here's the thing, conventional advice for younger adults, it doesn't apply to seniors. The rules change. And if you or someone you love is over 60 with hypertension, what I'm about to reveal in the next few minutes could literally add years to their life. We're diving into 5 critical things that doctors often forget to mention, but that every elderly person with high blood pressure absolutely needs to know. Stay with me, because number 4 is so counterintuitive, it might save your life. Let me tell you something that shocks most people. The ideal blood pressure for a 70-year-old is not the same as for a 40-year-old. For decades, we've been told that 120/80 is the magic number. And sure, that's great if you're younger, but here's what the latest research from the American College of Cardiology reveals. For people over 65, especially those over 75, aiming for blood pressure that's too low can actually increase the risk of falls, dizziness, kidney problems, and even cognitive decline. The sweet spot for most seniors? Around 130/80, or even 140, 90 inches, some cases. Why? Because as we age, our blood vessels become stiffer. Our bodies need slightly higher pressure to push blood efficiently to the brain and vital organs. Push it too low with aggressive medication, and you're starving your brain of oxygen. That's when people start getting foggy, falling, breaking hips, and we all know what a hip fracture can mean for an elderly person. I remember my own grandmother. Her doctor kept increasing her medication to get her perfect numbers. She started falling twice in 1 month. When we switched doctors and adjusted her target to 135/85, the falls stopped. She was sharper, more energetic, more like herself. But here's the catch. This doesn't mean ignore high blood pressure. It means working with your doctor to find your optimal range based on your overall health, medications, and lifestyle. Cookie-cutter targets can be dangerous. You're probably wondering, so what is my target? That's a conversation you need to have with your healthcare provider. But now you know the right questions to ask. Here's where things get really interesting. The same blood pressure medication that works perfectly for someone at 50 can wreak havoc at 75. Why? Because aging changes how your body processes drugs. Your kidneys slow down. Your liver becomes less efficient. Your body composition shifts less muscle, more fat, which affects how medications are distributed and stored. What does this mean? A standard dose can become an overdose for an elderly person. Let me break down the most common culprits. Diuretics, water pills,
let's review your medical
can cause
history.
dangerous dehydration,
We'll discuss the
electrolyte
procedure in
imbalances, and increased urination that leads to falls at night. Beta blockers may cause excessive fatigue, depression, and dangerously slow heart rate. ACE inhibitors can lead to persistent cough, dizziness, and elevated potassium levels. Calcium channel blockers often cause swelling in ankles and legs, constipation, and dizziness. Critical fact: studies show that seniors taking multiple blood pressure medications have a 40% higher risk of serious falls compared to those on single therapy. And here's what's crazy. Many doctors prescribe based on guidelines designed for younger populations. They might not adjust for age-related changes unless you speak up. The solution? Start low, go slow. Ask your doctor about, beginning with the lowest effective dose. Regular medication reviews every 3 to 6 months. Whether you can reduce the number of pills through combination therapy, monitoring for side effects specific to your age group. One more thing, never stop or adjust medication on your own. But being an informed advocate, that's not just smart, it's essential. Now, you might be thinking medication is the only answer. But wait until you hear what I'm about to tell you next.
First,
okay, this one is going to blow your mind. Ready? Not all elderly people with high blood pressure need to drastically cut salt. In fact, some seniors are actually salt deficient, and cutting it further can be downright dangerous. I know. I know this goes against everything you've heard. Let me explain. For most people, especially those who are salt sensitive, reducing sodium helps lower blood pressure. That's still true. But here's the nuance. As we age, our kidneys become less efficient at conserving sodium. Add in medications like diuretics, which flush out sodium, and you can end up with hyponatremia, dangerously low sodium levels. Symptoms include confusion and cognitive fog, weakness and fatigue, muscle cramps, nausea, in severe cases, seizures and coma. Research published in JAMA Internal Medicine found that elderly patients with the lowest sodium levels had higher mortality rates than those with moderate sodium intake. Let's be honest, this doesn't mean go crazy with the salt shaker. It means finding your balance. Here's the smart approach. Get your sodium levels tested, a simple blood test. Aim for moderate restriction, around 2,300 milligrams daily, unless your doctor says otherwise. Focus on cutting processed foods where 75% of dietary sodium hides, rather than the salt you add to home-cooked meals. Watch for signs of low sodium, especially if you're on diuretics. Think of it this way. Your body is like a finely tuned machine. Too much salt clogs the system, but too little? The machine sputters and stalls. You need the Goldilocks amount just right. But wait, there's something even more surprising about what you should be eating instead. Hey, quick thing before we continue. If you're finding this valuable and wish more people knew this stuff, do me a favor and smash that like button. It genuinely helps the algorithm show this to more people who need it. And subscribe if you haven't already, because I'm breaking down health myths like this every week. Hit the bell too so you don't miss what's coming next. Trust me. Number 4 is the one most doctors never mention. Okay, back to it. Here's something that causes unnecessary panic. Blood pressure variability. If you're checking your blood pressure at home, which you absolutely should be doing, you might notice it's 145, 88 inches the morning, 132, 78 inches the afternoon, and 155 over 92 after dinner. You start freaking out. Why is it jumping around?
It's so wonderful
is something
to
wrong?
I'm glad you
Take
could
a breath.
Join me.
This is normal for older adults.
You're doing
Research from the European Heart Journal shows that blood pressure variability increases significantly with age. Your readings can swing 20 to 30 points throughout the day based on time of day naturally, higher in morning, lower at night, stress and emotions, physical activity, meal timing, and content, bladder fullness. Yes, really. Room temperature, even whether you talked right before measuring, here's what matters. The pattern, not the individual reading. What you should do, measure at the same time each day, preferably morning and evening. Track readings over weeks, not hours. Look for the average trend, not daily spikes. Share your log with your doctor. They'll spot patterns you might miss. And here's the kicker. Obsessively checking and stressing about every fluctuation, that anxiety itself raises your blood pressure. I've seen people check 10 times a day, getting more anxious with each reading. It becomes a vicious cycle. Pro tip, measure twice a day max. Morning after waking, before medication, and evening before dinner. That's it. More than that, and you're just feeding anxiety. You know what's crazy? While everyone focuses on medication and monitoring, they completely ignore the one thing that might matter most. Alright, this is the big one. The thing that ties everything together. Orthostatic hypotension. That's the medical term for when your blood pressure drops suddenly when you stand up. You might know it as that dizzy, lightheaded feeling when you get up too fast. For elderly people with high blood pressure, this is often more dangerous than the high blood pressure itself. Let me tell you why. When you stand up, gravity pulls blood down to your legs. Normally, your body compensates instantly. Blood vessels constrict, heart rate increases slightly, and blood pressure stays stable. But as we age, this reflex slows down. Add blood pressure medications, which relax blood vessels, and the system can fail completely. The result? Blood pressure plummets. The brain doesn't get enough oxygen. You get dizzy, lose balance, and
I want to ask
fall.
you for a small
Shocking
favor. Please
statistic.
subscribe and follow
Falls
along.
are the
Your
leading
support
cause
means
of
the world,
injury
and I
and
can't wait
death
to
in
share
people
more with
over
you.
65.
It's going
And
to be all right.
orthostatic hypotension
Just
is a
take a
major
deep breath.
contributing factor
I'm here
in
for you.
20-30% of those falls. Here's what makes this so insidious. It often happens at the worst times.
Look
Getting
into my
up at
eyes.
night to
I
use the
see your
bathroom when it's
potential.
dark
Jesus, my
and you're
small
half
yellow
asleep.
bar. The world
Standing
needs your
up from a
courage.
meal, blood is diverted to digestion. Getting out of a hot shower, heat dilates blood vessels,